Hi everyone, my name is Sarah. I'm a certified fashion manipulation specialist and also acupuncturist, and I've been working in women's health for a very long time. I've created these menopause videos just so that the average woman can understand what's going on with her body, which I think is very important so that you can see why you're experiencing the things that you are. This is part 3. There are 2 other parts, and I strongly advise that you watch those before you watch part 3, just so that you can understand a lot of the jargon as to what's going on. Okay, so what is menopause? Menopause is a whole year of no period, which is classed as amenorrhea. So what that means is that you've had 12 months of no bleed. However, some women, and this has actually happened to myself, can go a whole 12 months and then you can have a period. So then you have to start from scratch again. So after you have the no period, then that means that you are going into your post. So we are talking about that 12-month time that's happened once your period stops. So this is what menopause is classed as. So the average age is 51. Most women 45 to 55 average. Pre-45 is classed as early menopause. Some women can have it as early as 23. And pregnancy can still happen in this part. And it can be hereditary. So if you are fortunate to know your mother's history, then it's always a good idea to speak to them to kind of understand what happened with their menopause, as you're more than likely to experience the same. So we are going to talk about the hormones. Now, in part 1 and 2, I talked a lot about follicles, and the follicles in menopause change a lot. So when we're born, approximately 1 million, and then when we get to the periods, they go down to 250. And then when you get down to the next stage, which is perimenopause, they've gone down even more, because between periods and peri, you've had loads of periods. You've also had lots of growth of the follicles, which means that they are going to die, which is called atresia. But when you get to menopause, you have approximately 100 to 1,000 follicles left. So that means quite a lot, actually, to do with the hormones, estrogen, progesterone, testosterone, which we're going to talk about. So the menstrual cycle that you see on the top is an average menstrual cycle of 28 days. You can see where the estrogen, progesterone is nice and easy, nice little lines up and down. Then the one underneath is the perimenopause, which we've talked about before. And you saw that going up and down like crazy. But when we get to menopause, it goes down a lot. Now, the reason for that, there's quite a few. So first of all, the feedback loop that is happening between the gonadotropin releasing hormone and the FSH and the LH is changing. It's hardly pulsing anymore because it's wearing out, and it's part of those things. It doesn't do the job for much longer. Follicles are not creating estrogen or testosterone, so that hormone is going to deplete. And as I said earlier, we've only got approximately between 100 to 1,000 eggs, so there's not going to be much going on there. But that also means that that's why you can still get pregnant in this year, because there are still some follicles. And if there's no period, there's no progesterone, because the period itself is, remember, the progesterone gets produced by the follicle, which is then released by the oocyte, releases the oocyte, and it's the structure around the oocyte that produces the progesterone. So anti-Müllerian hormone is undetectable because there's hardly any follicles left, and also is inhibin B, which is in the follicles. It's a serum that helps the follicle stimulating hormone do its job. So you can see here there's hardly any hormone activity going on. So let's look at the hormones. So we've got the estrogen, which is made from the follicles, also the top of the adrenal glands, which are on top of the kidneys, and the fat cells as well, which you can see here. So estrogens, we know, maintains good cholesterol, fights the bad, that's what it's there for, to do, to make sure that you have good cholesterol, good heart, good blood pressure. Helps with the bone regeneration, so it makes good bone density, and also the mucous membranes and the lining of the uterus and others, and brain function. So when the estrogen starts to dip, what we're going to see is getting joint problems going to start surfacing, because there is no bone, the density in the bones is going to change. We're going to see joint pain. We're going to see also the fat in the adipose is going to shift, because before, estrogen's job is to distribute the fat amongst the body, but now it can't do that, so it's mainly going to go onto the tummy area as well. And we're going to see cholesterol levels rising, as well as brain function not so good either. So there's a lot of things that having the estrogen that's going to make a big impact. So if we go to progesterone now, uh, it regulates sleep and mood, helps the bone, increases the metabolic rate, decision making, cognitive control, cravings. So again, the progesterone is made from the corpus luteum, and it's on top of the kidneys, the adrenals. So again, if we go into this poor woman who's really low and she's feeling really sad, so that's because progesterone's low, so she's going to be feeling quite low in herself. Lots of cravings, lots of cookies, because there's no combat in the cravings anymore. And then we have the testosterone, the sexual desire. Bone and muscle strength supports the skin and collagen production. So if we have a look at this one, we've gone too fast. Let's go back. On the left, sex drive is like revving up, and on the right, we have a very slow driver who's obviously not got much estrogen going on there at all. So yes, that's what's happening there. So the symptoms here that you see, I'm just going to put the light on. Okay, that's better. You can see me now. It's getting dark in the summer night. So the symptoms from all these that we've just gone through, the estrogen, progesterone, testosterone, there's loads of them. Muscle cramps, hair loss, dry skin, night sweats, memory loss, recurring UTIs, which is to do with the lining of the mucous membranes, hot flushes, depression, progesterone, muscular aches, pains, itchy vagina, we've not touched on yet, to do with the mucous membranes as well, and lack of estrogen down below. Loads of stuff there going on with these symptoms, and that's why a lot of women really struggle in their menopause, because it's a big shift, it's a big build up. Some women have a very, very bad build up in the peri, and then their menopause is not nice either. So I just want to talk about early menopause. We'll come back to menopause a bit in a second. So early menopause can happen due to a few things. If someone has a hysterectomy, which could be due to numerous problems, prolapses, heavy periods, they just can't cope with them, and it's making them ill, because obviously lots of blood, and that can happen in the perimenopause as well, when your periods get very heavy. Endometriosis, pelvic inflammatory diseases, or unfortunately, if someone's had cancer, then this can trigger early menopause from the treatment. And this is something that we're going to be discussing soon. I've got a good friend of mine who's coming on, and she's going to be talking about her experience with this. Because obviously, due to the treatment, they're not allowed to use HRT. So that's a good one to keep watching in the future. So let's look at post before we come back to menopause again. So post-menopause is 1 year of no bleed. So we've had the perimenopause, which is all the bleeding, all the symptoms. Then we have 1 year of no bleed, and then we're into our post, and that is it. The post is where then the next chapter begins. You'll kind of have the occasional follicle presence, okay, but the estrogen is going to reach its lowest point 2 years after the last period. So some women find the postmenopause a bit of a struggle. I definitely found the menopause a bit of a weird one when I had my first 12 months, because for the first 3 months, my brain, it was almost like my body was so in sync to having a period that I felt like I was going to get one, but I didn't. And then when you get to postmenopause, you're used to not having a period, but you'll find that the symptoms change as everything changes. It's not textbook. You don't have one symptom and then have something else another time. Sorry, it doesn't stay the same all the time. It's very, very much up and down. So in postmenopause, we are looking at these kind of things. Osteoporosis, obviously bone density, because as we get older, less estrogen, we're more likely to get fractures if we don't take care of our joints. Cardiovascular disease risk because of the arteries and because there's cholesterol, estrogen's not doing its job. UTIs, they're a big thing that happens. Again, to do with the mucous membranes down below not being lubricated enough. Adipose tissue around the midsection, that's to do with both estrogen and progesterone because of the metabolic. Potential for diabetes type 2, that comes with the adipose. Stomach IBS tissues, depression, anxiety, that can go on for some time for some women. So in menopause and also post, what can you do to help yourself? Well, this is why I love talking about these subjects, because it will give you such an opportunity to really think about where you're at, why you're experiencing things that are going on. And sometimes it's more like a light bulb moment. Okay, I'm not going crazy, I've got this happening and this is what I can do about it. So there, first of all, there's so much emphasis on weight training. It's always been there. Uh, Before I started getting into therapy work years ago, I did a lot of training with women, and bone density is obviously needs to be increased by weight bearing exercise, and that can be using weights, that can just be your own body weight, but that helps keep the bones nice and strong. And that will help you in the long term, especially if you've got someone in your family that has had osteoporosis. That's something that's essential for you. We've got to keep the brain active, so reading, puzzles, that kind of stuff. We've got to keep the body with good food, good fats, so that we don't block up the arteries, because we don't have that fight anymore from estrogen. And that's going to help us with our moods as well. Stretching is key, because lots of things are going to happen in the body that are going to get tight. I'm going to talk about that another time, especially on frozen shoulder. I'm going to do a video on frozen shoulder coming up soon. But stretching is key, because our tissues get tighter, which means that we are stiffer, which can cause injuries if we don't address those. Good cardiovascular heart, so lots of cardio exercises, could be just walking, just getting that heart moving, drinking loads of fluid, keeping well hydrated to help those UTIs, and obviously to help everything else be hydrated. Things like taking meditation, relaxation to calm your stress levels, which will help your adrenals as well, because the adrenals are going to work doubly hard in postmenopause, so that's really good for that. And last but not least, supplementation is really key. So if you're not on HRT, supplementation is really going to help you, and there's lots of things that you can take, and we can talk about that another time. But it's just important to think about, yes, this is happening to my body, but there are things that you can do. And if you watch this, and even if you've watched it all the way through in your peri, definitely start on this stuff now, because this will impact your post when you get there. So I want to leave you with one final thought, and that's a red herring. Please be careful with menopause symptoms, because there a lot of people will have symptoms and they won't be menopause. Advocate for yourself. You know your body. You know what you're like. If you feel that there's a problem and you've got a gut feeling, then you go and get it checked out, and you push until you do. There are stories of women that have had problems in their menopause and it's not menopause. So yeah, advocate for yourself. And if you do have a bleed outside of the 12 months of menopause, then get that checked out. Go and get it checked out. It's the best thing to do. Okay, so that wraps up the menopause information. Thank you very much for watching. I really hope you've enjoyed it. Sorry about my darkness in the beginning, but there's light at the end, which is hopefully what you've got from these videos. There's more to come, and the next time you'll see me, I will be talking to someone about their experience with going through an early menopause due to cancer. All right, you have a great evening, and I'll see you soon. Take care.